Hello, this is John Sharp, and today I'm speaking on social media and healthcare, a reasoned approach. A little bit about me: I'm manager of research informatics at the Cleveland Clinic, basically a information technology expert in the area of clinical research. A little bit about the Cleveland Clinic. Our main campus is a 1,300-bed hospital, but we have regional hospitals in the Northern Ohio area, 2 million patient visits, and at our core, really a group practice of 2,700 salaried physicians and scientists, and known for our innovation as well as our Office of Patient Experience, and various locations around the United States, also in Toronto and in Abu Dhabi. There are opportunities to collaborate with us, and I'd be glad to talk with any of you. You can see my contact information at the end of the slideshow. So the question for today is: social media in healthcare helpful or harmful? My approach is, with proper controls in place, social media can have many benefits in healthcare for hospitals and other healthcare organizations. I really believe that social media is changing the conversation in medicine today, and part of the revolutionary change going on in medicine. So why do hospitals fear and block social media? There's several reasons. There are concerns about revealing confidential patient information, posting unauthorized photos or videos, looking unprofessional, making negative comments about patients or the hospital, giving unauthorized medical advice, negative comments by patients about the hospital, or employees just wasting time and being distracted from giving care. But the advantages outweigh the risk, in my view. There's ease of use, a low barrier to entry, improved communication, patient engagement, and at the bottom line is what's called participatory healthcare. So how to proceed? There was a case study done last year on our stepladder approach to social media success, and I'll talk a little bit about that. Back in the early days of social media, there were several individual bloggers, including myself, but no policy and little awareness in the leadership about how to use social media and its impact. But starting out, we found that by listening to what people are already saying in social media about us, that we could learn a lot. There's this concept of temperament analysis, that is, are people saying good, bad, or neutral things about you? And most of what we found is that they're saying good things about us. And here's some examples from our Facebook page. So the first step in transformation was our chief marketing officer brought together key stakeholders within the hospital, developed a strategy, launched Facebook and Twitter accounts, just a few posts per week, mostly pointing to news items and press releases, and developed an employee policy. And the social media policy, several pages long, but some of the key elements is: don't share patient information, only specified employees really speak for the hospital, and if you have a personal account, it's really your own opinion, not that of the hospital, and don't let social media distract you from your work. Patients always come first. Step 2 was to expand the YouTube channel, posted some of our existing videos as well as doing more with FlipCam, interviews with patients, physicians, and researchers, and focusing on wellness messages in both Facebook and Twitter, and initiate and expand our online chats and integrate messages with our traditional media outreach. And then really the third step, which occurred this year, is developing blogs and new programs, one called Move It, using social media and local sports to engage the community in more physical activity, and encouraging postings on our Facebook page and engaging patient communities. Specific to that, rare diseases are ideal for this because people are often disconnected from each other when they're involved in social media, if they're not involved with social media, and may not be aware of other people with the same disease. Some of our early missteps included not having a social media expert on board from the start. Sometimes we get, in the United States particularly, get overly competitive rather than focusing on our unique approach to social media. Delayed the use of social media at work, blocked YouTube and other streaming media, and lacked the education of employees about how to use social media in effective ways. A lot of other people are doing really good education in social media, and this from Webicina by Bercy Mesco is an example of a course specifically oriented toward physicians about social media and Web 2.0 technologies. And another opportunity is a short video called Digital Smarts, which really has to do with educating medical students and residents about digital professionalism, how to be professional in the use of social media if you're in medical practice. There are legal issues, and I've covered some of these before, and they also include possible regulatory issues, particularly around new drugs and devices, codes of professional responsibility, and potential conflicts of interest. But in conclusion, there really is an opportunity to use social media for great effect in healthcare, particularly in engaging patients with hospitals and providers, for patient communities and e-patients to interact with each other to really learn more about their illness, how to cope with their illness, how to talk to their doctors. Professional online communities where physicians, nurses, and even health IT professionals can talk to each other and learn more about current trends and communicate on an international basis very quickly. And then also the use of apps, mobile apps, and other tools to improve health. There have been misuses of social media, but I think these can really be minimized through employee policies and education. We need to listen to what people are saying about us on social media and encourage employees to minimize the use of personal mobile devices in care settings so they don't interfere with care. In conclusion, feel free to contact me. Here's my Twitter account, blog, LinkedIn, and I will also post these slides on SlideShare. And then the Cleveland Clinic Twitter account, Facebook, and YouTube, which I'd encourage you to go visit. Thank you very much.